Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 4 of our course in healthcare research. And once again, a very nice week discussion. On week number 3, the primary task was to once again review these two articles. The first was the Beck article on post-traumatic stress in childbirth, and the Kolkaba article on the efficacy of hand massage. And the primary task again was to go through and talk about the structure of these two articles and to answer the question, was there a significance for nursing? Was there some tie back to nursing practice or some significance stated for the profession and the practice of nursing? And also, was there a hypothesis, and if there was a lack of hypothesis, was that appropriate? And pretty much everybody nailed this one pretty well. The Beck study is a qualitative study, and as a qualitative study, there's no independent or dependent variables. There's no effort to try to compare one group of individuals with another or to try to correlate some behavior or some intervention or anything with these women's experiences. The goal of the study was simply to explore what is the lived experience of these women that report having PTSD after childbirth. Notice also, Beck doesn't try to justify, is this even a real thing? Other studies have brought to task, is this really such a thing? Is there any such thing really as post-traumatic stress in childbirth, or is this some other manifestation? Is this actually a manifestation of something else that essentially this PTSD is being referred or projected onto childbirth when really it comes from something else? But those are completely different questions. Here it is simply what are these women's experiences? What do they report? What do they feel? And the significance to nursing was explained towards the end of the article. You should also state that in a qualitative article, usually the article just starts with, or the research question is something along the lines of little is known about, or we've identified this phenomenon and it's been mentioned in the literature, but we really don't know much about it. So we need to find out more. And hopefully as a result of that research, we can come up with new research questions, new information that will help us to guide us into new research. And that is how Beck ends this article. She discusses the themes that were identified and wraps up a little bit about what these experiences were in the study, and really more implies that there's a tie to nursing practice here. She doesn't explicitly state it. She refers to clinicians, and it's important to realize that in this study that nurses are inclusive within that. We are clinicians. Clinician is a rather general term, but essentially it means that anybody who is working in a clinical setting with patients. So the scope of this study was wider than nursing, but nursing certainly falls within it. It's certainly within our scope to be included in the term clinicians and healthcare workers that would be working with these women. And we would be running across them in any number of settings, in primary care, in the hospital, in labor and delivery, in psych, and in many different areas. So that is why some of you had picked up that the significance to nursing specifically could have been made more directly, but realize that in a study, particularly a qualitative study, such is not always the case. Usually the decision as to how much significance there is left more up to the reader of the study than the researcher themselves explicitly stating it. In the Kolkaba study, it was a little bit more straightforward because this is a quantitative study, and it was one specifically dealing with the nursing intervention, one not necessarily that would be done by a nurse specifically, but one that would be overseen and would be included in a nursing care plan. This idea of providing a hand massage to increase comfort. This is a little bit stronger and a little bit easier to see the clear direction and the clear significance to nursing practice. And of course, because this is a quantitative study, it has a very clear hypothesis. The hypothesis being that the hand massage would increase comfort in these individuals, these patients that are in hospice care. And it can be statistically shown whether this is a true statement or not. And that's really the goal of quantitative research, is to try to show relationships, to try to show that one thing has an impact on another. And so therefore there was a formal hypothesis and an independent variable within this particular study. So once again, we'll be visiting these again, and we'll be talking about these concepts once again. But very nice discussion this week. And in week number 4, we shift gears a little bit. We're going to start talking about and focusing primarily on quantitative research. And here we're going to be talking about a new article, one that we haven't reviewed in the class. And this is the Aiken et al. Article on hospital nurse staffing and patient mortality, nurse burnout, and job satisfaction. This is a very wide-ranging study, and we'll be talking about this over the next couple weeks. This week we'll be talking about the research design. What was the research design that you identify that was used for this study? What procedures were used to control for variables and something called confounding variables? In other words, what controls were set up by the researchers in this study to give some purity or to help give some validity to the idea about the relationship between variables to the outcomes that they review in this particular study, and then talk about threats to internal validity. And again, these are primarily quantitative terms consistent with a quantitative methodology, although they do also, these terms are appropriate also for qualitative research. Really, in quantitative research, it's really important to control variables as much as possible. And so we'll talk about that. That's going to be the focus of your learning this week and the focus of the discussion questions. Also, opening on Wednesday is going to be your midterm exam. I posted a little bit of information about it. It is going to be a 50-question exam. You'll have 100 minutes to complete it. Please make sure that when you open the exam, plan to complete it in one sitting. If you log out or if you get kicked off the internet in the middle of that exam, what will happen is it will essentially freeze up on you, and you will not be able to go in and complete it once again. And most likely I will have to go in and clear your attempt for you to be able to complete it. So as you have any technical issues, please let me know. I will work to get those fixed as soon as possible. Make sure that you time it so that you have it completed by Sunday night. It's going to shut off Sunday night at midnight. So you'll have from, might be Wednesday morning at midnight at 12:01 a.m. through Sunday night at midnight to complete that midterm exam. You can, 100 minutes, anywhere within that time, you'll be able to do that. And of course, the usual discussion questions this week. Week number 5, you have your first research critique due. Please review the syllabus. You want to get started on that soon, because that's an assignment that actually takes longer than it may look. So please download the template for that, review that assignment. I will just say now that it is an assignment that you do not have to write a paper per se. You just have to complete the template. There's a template that is posted in Blackboard, so you download that template and just type into the template. You don't have to write a separate paper. As you have any questions about that, please let me know. I'll be talking about it more specifically next week in my introduction, but it's something that you want to keep on your radar screen for right now. So I hope everybody has a great week. Look forward to my grading feedback later this week, probably on this week will probably be Thursday. I look forward to participating in class with you, answering any questions, and I'll see you in the discussion forums.